Okay. And how do we manage the side effect and how do we stay well? So common side effect from the initial therapy is usually people will have fatigue, low blood count, increased infection risk. They will have nausea, and sometimes people might have numbness and tingling in the hands. And supportive care really help manage those symptoms. And a couple of things that I always want to make sure my patient and I make sure my colleague all do is that ask them about, should you get the growth factor for the white blood cell boost? Ask them about if there's better ways to control the nausea, and ask about if you should be on any antibiotics or antiviral therapy to prevent infection. And one question I always get asked about my patient, which they always ask if there's anything they can do to help to get a better outcome. I always tell them that, we unfortunately in the oncology world, we don't have enough study to look at, nutrition, exercise, and mental support, how that helps outcome of lymphoma. But in my opinion, if we can help the immune system to recover and regenerate, then we'll help the body to better fight off the lymphoma. So I tell them nutrition is the most important thing. If they can keep on the same weight through the treatment, they usually can do a little bit better. And I always ask them, they don't have to do heavy lifting or anything, but just walking around, 30 minutes every day, even on the days that they're really tired, can help your body to receive the signal, hey, I'm trying to heal here. And then the last thing is the mental health support really matter too. It's inevitable that patients, once they diagnosed with disease, they're anxious, they're depressed, and as a result, they are not sleeping well. And I think there's always a body-mind connection. So you have to have a positive mind in order for the body to do positively. So if you need any support to help the sleep or help you feel a little bit better, less depressed, let your oncologist know, let your primary care know. Maybe they can help you with that. And I really like this quote from this NCCN patient guideline is that you may not control every side effect, but you can control how you face them with knowledge, preparation, and support. Okay. And what happened after treatment? So after treatments, after patient achieve remission or after they're done with transplant, the regular follow-up is very important with oncologists. In lymphoma, we usually say, in B-cell lymphoma, we usually say follow-up for 5 years after you complete the treatment. For T-cell lymphoma, I like to keep my patients forever with me just because there are late relapses that can happen. And the second thing is I always tell patients to be very aware of how they're feeling, to be in tune with their body. If they find area that is new, like it's swollen, or they start developing nice sweat, not the like gentle sweat, but like if they're waking up, the whole bed is soaked, or they start having fevers for a long time, then they really need to contact me and let me know. And I can restage and make sure that if the disease relapse, we catch it early. And long-term survivors exist, even for very aggressive subtype, as well as for patients with stage 4 disease. So don't lose hope. We're improving the outcome through research and collaboration. And I think that's something that makes me very excited about the future of T-cell lymphoma treatment. And this is one of the cancer survivor told me, and I think it's very highly philosophical, and I really liked it. So I put it here. So every follow-up visit isn't just a check; it's a step forward in your story of healing.